And generally, we do this on the first and third Friday of every month, and they are free and open to everyone in the community. No membership is required. We always put the schedule on our calendar and on the website in the events section, but registration is absolutely required for Zoom access. And we try to get that out to you, and we try to send it out several times just in case you miss an email and you can get in. Ashlyn is our membership experience coordinator, and she's on the call, and she always has the access codes. So if for any reason you get locked out, you can just send an email to membership@jeffcountychamber.org, and she will get that out to you so fast that your head will spin. Um, Today we are in a very timely fashion talking about COVID updates and vaccine updates. And all of us have been following the governor's site and the news and know that everything is sort of not a straight line path these days, that things are morphing and changing on a really regular basis. And we need to stay on top. And what I heard from a lot of members is we're not. So we got the experts on the call today to give us their updates, and we are now posting their updates on the chamber website. So with everything they say, we're posting the data so you can find it easily at jeffcountychamber.org. You are all entering muted. So when you go to speak, it's so hard, but try to remember to unmute yourself and to remute when you're finished. And generally we have 30 or 40 people sign up, and we're right in the middle of that today. And we generally lose about 50% before we get online. So we'll see how that works out. But we do record this and we put it up on YouTube. And we send invitations out to several different audiences of people to view that. We usually get a couple of dozen views the same day, and over a period of a week to 10 days, several hundred. So whatever you say today is going to reach a broad audience. And by the time the last people see it, hopefully we'll have updated it. During the cafe, I have chat active. So please, if you have questions, put them in the chat. And I know all of our panelists will be here to answer questions directly as well. So with that, I am going to take a back seat here and turn this meeting over to Willie and to Deborah, who are in their DEM roles going to give us an update. Welcome to you both.
Thank you so much, Arlene. My name is Willie Bence. I'm the director for the Department of Emergency Management here in Jefferson County. And then Deb Stinson, who is a volunteer with us. She's a founder of our NPREP organizing group, which is a partnership between us and Local 2020 to help basically get our community prepared to reach out to individual neighborhoods, encourage neighbors to meet neighbors, talk about disaster preparedness, all that kind of fun stuff. So Deb has been our business liaison throughout this response. And she's been working closely with Arlene to help coordinate some of the chamber's activities. She's been kind of the go-between between the two agencies. So Deb has been one of our rock star volunteers for many, many years. She was on my interview panel, actually, when I interviewed for this job. So it's partially her fault that I'm here. So you can blame her for that. So thank you, Deb. And then I also should note, we're joined by Amy Yaley with Jefferson Healthcare as well. And we'll have her chime in when we talk a little bit about the vaccination efforts here in just a little bit. I do want to note that this is kind of an informal presentation. I don't have a slide deck or anything fancy to show you. I want to make sure that we give everyone time to be able to ask questions. What I'm going to do is kind of go over the current state of the county and the current state of COVID in the county, talk a little bit about the reopening plan, and then finally wrap it up with the local vaccination efforts. And I won't be able to answer every kind of in-depth question, but I do kind of want to give folks some perspective. I think it would really be helpful for me to explain some of the thought process behind some of the decisions and some of the tierings, and at least give you some context, even if I don't necessarily agree with all of the decisions maybe being made at the state or the federal level. So again, informal talk will give you plenty of time to ask questions, and I hope that at the very least you come away with a better sense of understanding at the bare minimum, if not having all of your in-depth questions answered. So just to kick us off, here in the county, we continue to do very well in terms of the COVID infection rate. Throughout this entire response, Jefferson County has been one of the top counties in the state of Washington in terms of keeping COVID at bay. A 2-week period that ended just earlier this week, we only had one COVID infection, and our 2-week case rate per 100,000 people, which is what the state uses to measure the rate of COVID within your community, sat at just 3. A little bit over 3, which was representative of just that one person over that 2-week period. Whereas just a few months ago, we were sitting at about 150 per 100,000 over a 2-week period. So it has dropped precipitously. So we're really fortunate for that. However, this past week, we have seen an uptick in COVID cases. So that number is going to go up when they do the recalculation early next week, but it's just a testament to how well we've been doing out here in Jefferson County. I think the really important thing to stress about the cases here in the county is, where they're coming from and how they're happening. And the Department of Public Health, as well as Jefferson Healthcare, are really sensitive about specific case information that we can share. So I can't talk. I myself don't even know a lot of the details about these, but what I can share is that a good majority of our cases, or at least a significant number, have come from folks who travel out of the area and then bring it back with them, or have friends or family who are coming into the area and then bring it in with them. And then how it's transmitted, it's mostly through these close family contacts where they're in each other's homes, they're eating together, they're having a dinner in the home, they're hanging out and socializing, or they're staying overnight with one another and actually transmitting COVID that way. And I think one point I really want to emphasize for the business owners is what's considered a close contact for COVID-19 transmission. And that is if individuals are less than 6 feet apart and unmasked for 15 minutes or more over the course of a 24-hour period. So we're really seeing transmission when these individuals, again, they're not social distancing, they're not wearing masks, and they're spending time together. And so it's that definition of a close contact which is driving a lot of the state's decisions about reopening. So in a retail setting or at a restaurant, what they're hoping is that folks are being masked if they're going to be less than 6 feet apart, and that we're limiting the total time of contact. So it's that kind of that process and that hope that's what's driving some of the reopening paradigms. And then again, if folks are staying masked, they're staying more than 6 feet apart, or if that they're going to make contact with each other, you keep it for less than 15 minutes. That is goes a long way towards limiting the chance of a COVID-19 infection. So again, here locally, we're seeing people who are traveling or bringing guests in, and then they're not necessarily transmitting it, when they're out and about. They're transmitting it when they're socializing in close contact. In workplaces, and we saw recently that the certain congregate work settings were prioritized for vaccination. And it's because those kind of workplaces were the kind where folks can't social distance. They're in contact for long periods of time. Things like, the agricultural sector, food processing, corrections, like our dispatchers over at JeffCom 911, where, they just can't maintain that sort of separation and they can't keep their contacts brief. So those are the kinds of things that we really need to be focusing on. That's how we're seeing people getting infected, by ignoring those kind of close contact protocols. And then again, that's driving kind of what's reopening from the state. So as I said, that's informed how the state is making vaccine tiering decisions. They really focused on the people who are at the greatest risk first and foremost, which is why we saw the 65 plus age band prioritized. It's why we're seeing folks with, comorbidities or disabilities being prioritized. And then they're prioritizing workplaces, again, based on who is at the most critical risk for contracting COVID-19, which is why our healthcare workers and first responders directly in contact with either COVID positive or suspected COVID positive patients were first. Then they're focusing on the congregate work settings, and now they're moving on to other workplaces, specifically restaurants, which is they're going to be eligible at the end of the month. I personally would have liked to see them available earlier, but it's one of those things that the state had to make prioritizations based on a limited amount of vaccine that was coming in. They made a tough decision. And again, it is what it is. They're going to be available moving forward. I really would have liked to see them support our restaurant workers who've been, working throughout this entire pandemic, often in contact with unmasked customers. We do find that eating in a restaurant does present risk to the individuals who are sitting and doing the eating, especially if they're from different households. But fortunately, the risk is reduced to the waiting staff who's working with them because they're not in consistent long-term contact with them. They go and take the order and then go back. But still, I'm glad that they're finally able to hopefully get protected by having access to the vaccine. So we'll see that change come up on the 31st. One thing I do want to note here is that these changes from the state, these vaccine determinations, the reopening plan, sometimes we at the local level, it can be a little bit frustrating at times because often we hear about these changes the same time that you do. So when it's announced in the media, it's a decision that was made maybe the day before, and then the state will bring it out to the media the same time local jurisdictions are hearing about it too, which when things are moving fast, you can't necessarily expect, a week lead time to kind of get ready. So we're hearing about these things the same time that you are more often than not. We're trying to figure them out as you're trying to figure them out. And that's just kind of the nature of the beast, more or less. I think at the state level, they're doing a pretty solid job. I know folks are frustrated at times with the fact, especially in terms of the recovery plan. We were county by county, then on a regional basis. Now we're back to county by county yet again. So those course corrections can be a little bit confusing. But what we found is they do listen to our feedback. They are making changes based on the feedback, based on the data. And I'd rather have those course corrections than a stubborn kind of unwillingness to change. The federal government has been a different beast. Right now we have 50 states doing things 50 different ways. And then sometimes whenever the federal government does come down with a proclamation, again, just like at the state level, we hear it the same time you all do. Federal government makes a decision, then the state has to scramble to add our own kind of local clarification. Then it trickles down to the local government, and by the time the local government's figuring it out, oh, guess what? The federal government has announcing something different. So it's been frustrating for us too. I've been saying a lot recently that they call these things disasters for a reason, and that's because they are messy. They're not pretty whatsoever. And so just know that we share your frustration on a lot of different things. This hasn't been perfect for us either, but we appreciate your patience, and we appreciate folks like Deb and Arlene who have stepped up to help work with you all to make this as easy as it can, if I can even use that word. So coming up, one of the decisions that came out from the state yesterday, a latest change to the vaccine tiering. Again, 60 plus, folks aged 60 plus will be able to get their vaccine starting March 31st. Other folks who work in certain congregate settings, like those in construction, those working in restaurants, etc., will become eligible for the vaccine. And this is all part of the state trying to recognize President Biden's goal of having the vaccine being made available to everyone come May 1st. And that's something the state is working towards. The roadmap in terms of the vaccination eligibility isn't made abundantly clear what it'll look like until that time, again, because they're trying to figure it out on the fly based on this new directive from the federal government. But that is the ultimate goal, but we'll see how that works. It should be noted that that May 1st deadline means the vaccine will be made available. Everyone will be eligible. That doesn't necessarily mean that everyone's going to have an appointment by then, and it certainly won't mean everyone's been completely vaccinated. So just wanted to make sure kind of that was clear, but that's the goal that we're working towards. Again, with the phased reopening, the governor did announce that as of the 22nd, this coming Monday, we will be in phase 3 of the reopening plan, which allows things like restaurants to operate at a 50% capacity, large gatherings in terms of being able to attend sporting events up to 400 people at other events, et cetera, et cetera. And I'd really recommend that everyone bookmark coronavirus.wa.gov. And that's the state's kind of all-in-one COVID-19 portal. So you can look at the metrics that they're using. They did make changes to how they will be moving forward small counties under 50,000 in size, and then large counties over 50,000 in size. They've made changes on how they might move forward phases in the future. You can look at all the specific determinations for how businesses can reopen and what. So I won't go into too much detail on that there, but check out that site. And then again, thank you to Arlene for helping to clarify, and Deb as well for helping to clarify some of that with all of you and help push that information out. Because again, it has been confusing. It's been changing so much. So I appreciate the effort from everyone to work to understand what's going on, because it has indeed been a whirlwind. As I mentioned earlier, I know a lot of folks are concerned about reopening, and I do share a lot of your concerns. The big thing is that the reopening was made, these determinations were made based on where we're seeing risk of transmission. And again, less than 6 feet, no mask, 15 minutes or more. And I just got a question in chat. Is anybody else not hearing me? And I hope since some people are nodding their head, some people are, but it sounds like Charles is having some difficulty. So, all right, so it sounds like it might be an issue on your end, Charles, if you want to take a look at your sound settings, but let us know when you're back up. I guess he's not even hearing me, so I don't know why I'm saying this. If you can help him out in chat, that'd be great. So that's how some of the reopening determinations were made, again, based on where we're seeing the risk of transmission. And honestly, one of the reasons that things have been changing so much over the course of this response is because we are learning more and more about this virus. We are learning more and more on how to mitigate transmission of this virus, which is why things like, I know a lot of people were frustrated when the recommendation came out to wear 2 masks, to double mask, as they call it, wearing a surgical mask with a cloth on top of it. And that's because, one, the supply of surgical masks opened up greatly in recent times, whereas in the initial onset of the pandemic, we had to really carefully ration those and really make sure that we were keeping those in the hands of the critical workers who need them the most. So supply chain opened up, but also we've just been learning more and more about this virus. We've been learning more and more about how it's transmitted, and we've been learning more and more about how to protect one another from it. So we're going to update recommendations based on those new findings. And I know some of the anti-maskers, some of the kind of COVID denialists have argued that that represents a flaw in the scientific system, that, oh, they can't make up their minds, the experts don't know what they're talking about, when in fact, that's evidence of the scientific process working as it should. We're willing to constantly question what we're learning. We're constantly learning more and poking and prodding and trying to find additional information. And then we change our recommendations based on those findings. So again, it's been frustrating, the fact that it's been changing so often, but it's really evidence of our scientific process working as it should, as we are able to learn more and then again, course correct based on that data. That being said, as we're reopening though, a lot of those assumptions are based on the fact that folks adhere to those recommendations by staying masked, by staying socially distanced. And we know that, once you insert the human element into things, things aren't always going to function as they should in an ideal world. So we really do appreciate your work in helping distribute masks and reminding sometimes, often belligerent customers about masking policies. We know as things open up and more people start to enter businesses, start to interact, it's going to be harder and harder to keep them in line and keep them adhering to proper masking protocols. It's also going to be difficult as the vaccine starts to proliferate more and more. Obviously we have unvaccinated folks who represent a lower risk, but then we're going to have unvaccinated folks as well who might not be honest about the fact that they've been vaccinated or not. We're going to start to see potentially some butting of heads. So please do report if you or your business are experiencing ongoing issues. I mean, obviously, if you have a difficult customer who's representing a disruption, do call law enforcement. If you're having ongoing issues, do reach out to us at DEM or to public health, and we'd be happy to work with you and offer some suggestions on how to remedy that. Because again, the burden on you and your employees to help enforce some of this stuff, again, we appreciate it, but I can only imagine. I want to say I understand it's been a headache, but I really don't know what it's like to have to day in, day out be mask police. So again, I apologize for that. I appreciate the work that you're doing to protect our community. And it's going to have to stay that way, at least for the foreseeable future until we do reach an appropriate level of herd immunity. So reach out if you're having ongoing issues. So that's all I wanted to say about the current state of COVID-19 in the county and some of the reopening concerns. Before we talk about the vaccine efforts, any quick pause for any questions, comments, anything of that nature. All right, so not hearing or seeing anything.
It looks like Richard has his hand up.
Oh, sorry, I missed you, Richard. Go.
That's okay, Willie. I have a quick question, and mainly it's because I have some staff who are quite literal when they hear some of the guidelines. For example, we talk about 50% capacity. Now, in my mind, I think that that's 50% of the people you had in the office before COVID. You have like 12 offices, you have 6 can be occupied. But what I'm getting asked by some staff members is it based upon square footage or just workspaces?
So that's one thing I will need to clarify for you. I'll get a specific answer for that and then have Arlene, if you don't mind, loop back with everyone, because I've heard both, to be perfectly honest. Because again, you can take that via fire code and overall approved capacity, or just based on, again, who is sitting there previously. So let me get specific clarification on that for you.
Okay, and I just want to say that I am grateful I live in Jefferson County during this pandemic, because I think the county has done an excellent job of keeping us informed and also protecting us. And also I'm glad I live in Washington State, because I think the governor is doing an excellent job as well. I mean, this is uncharted territory. And like you said, things change as the science changes, but that's because we're in a new reality of this pandemic we've never dealt with before. So I just want to thank you all.
No, and thank you. And again, we've been doing our best to try to navigate this, but I chalk it up. Our community is just so phenomenal, and they've stepped up, and that was the entire focus of NPrep again, which Deb helped start, and that's really the government can do so much, and we have a saying in the neighborhood preparedness group, and it's called yo-yo, or you're on your own, and it was really designed after a major earthquake when the entire infrastructure is knocked down. You can't call 911 and have a fire truck there within 5 minutes. You're going to be on your own. And so thankfully during a pandemic, it's not quite that extreme. But still, this is one of those where we wouldn't be in the situation we're in without our community, without everyone working really hard to help make this happen. So we'll get you a little bit of clarification on that one piece, but again, thank you. We do appreciate it. I will say too, while I'm at it, one thing that has been difficult about this is that we've, I don't want to say we've ignored pandemic preparedness, but we've definitely put it on the back burner. I've been throwing out the idea a lot, or the kind of fact a lot recently, that our local public health department used to every single year do a pandemic response mass vaccination clinic, where they would have an exercise where they just use the flu vaccine, but they'd stand up a pop-up clinic to kind of exercise. Well, if we had a pandemic and needed to vaccinate a lot of people, how would we do that? They used to do that every year until 2015, when the funding got cut for it. And now 6 years later, they're rusty. They haven't been practicing. They haven't been planning. And then now we have a pandemic, and we're not as prepared. We're not as well trained as we could have been. So this is something coming out. I really hope we do put a renewed focus on pandemic preparedness and on emergency preparedness and disaster preparedness in general. But part of the reason that again, the information has been constantly changing, again, because the science has, but also because we haven't been preparing and training and readying ourselves for this like we could have and should have been. So I wanted to throw that out there as well. So having said that, we'll move on to the vaccine effort portion of this. And this is where, Amy, I'll tap you on the shoulder here in a little bit. So the current state of the vaccine distribution, we have a kind of three-pronged approach in helping vaccinate the county, although one prong is a little bit bigger than the others at this point in time. So we have Jefferson Healthcare, we have the local pharmacies, and then DEM, Emergency Management and Public Health. And then really, Jefferson Healthcare, they've been an absolute rock star. They've been doing the vast majority of the vaccine delivery in the county throughout this. They started in, I believe it was late January, and have been operating continuously since then. Again, Amy, I'll have you chime in with some stats, but they've been open 6 days a week, doing about 350 a day. And they've been doing that for the past couple of weeks as they've reached full capacity. Then we have the local pharmacies. Tri-Area Pharmacy has been doing a wonderful job as they've been getting vaccine in, as has Safeway. And then, nationally, there's lots of chains that have been getting vaccine directly through the federal government or directly through suppliers like, Walmart, in Kitsap and Clallam, et cetera, who are also helping deliver vaccine there. And so our local plan as it stands right now is Jefferson Healthcare. They're the steady state. They're the largest capacity. They're kind of going, and they're our biggest supplier, and they're the biggest push towards getting our community vaccinated. Again, 6 days a week, 350 doses a day. The pharmacies have been doing some spot duty. I believe they're a little bit under 20% of the vaccine delivered into this county. Again, some of our larger chains, and then Tri-Area locally doing a phenomenal job. And then DEM and Public Health, we've been planning to do kind of cleanup duty. And as vaccine supply has opened up, we're going to be offering clinics in communities throughout the county. So we're targeting Chimacum at the Chimacum School District's multi-purpose room this Saturday for our first clinic of 300 doses. And then we have plans in the future to offer clinics in South County, Quilcene, and Brennan, and then anywhere else we need to kind of bring the vaccine to people. We're also coordinating with the state to, the state's going to be offering up some mobile teams to help vaccinate people who can't travel, so individuals who are homebound, to actually vaccinate them in their home once we have, the Johnson & Johnson vaccine availability is going to be critical for that. So we can just make one visit. It's a little bit easier to transport than the others, etc. Throughout all this, though, vaccine availability has been the biggest limiting factor. We request once a week, we request how much vaccine we want from the state. And then every single week, we find out how much vaccine we're going to be getting. So we haven't had a good eye on exactly how much we're going to be getting long term. Again, it's going to be kind of as you go. So right now we're committed to keeping Jefferson Healthcare as fully stocked as possible. Again, there are the steady state, they're shouldering the biggest portion of this burden. Other pharmacies are getting directly from suppliers. Again, these national chains are getting from the federal government. And then we at DEM and Public Health are going to kind of pick up some of the spot duty, kind of as like a hotshot team, so to speak, from there. And so the state is coming out with an allocation model. So we will have a little bit better insight as to how much we're going to be getting long term. And I want to warn everyone that we might be victims of our own success. Right now, I believe we're number 2 in the state in terms of percentage of our population that has been vaccinated. Again, then that's due in large part to the great work from Jefferson Healthcare and our local pharmacies. But there's a chance that we might be seeing a little bit less vaccine here moving forward. But again, that kind of remains to be seen. We'll keep you updated from there. So I will go ahead and Amy, if you want to talk a little bit about Jefferson Healthcare's efforts so far, now's your chance to chime in. I know this, again, relatively informal, however long you want to speak, whatever you want to touch on. I'll go ahead and turn over the floor to you real quick.
Sure, thank you. Can everyone hear me okay? All righty. So as of last night, we've administered about 13,481 first and second doses. And that accounts for about 5,100 people receiving a full cycle. So that's great. I think 18.75% of our population now has had 2 full doses. I was just on the phone with Dr. Locke, and he, so Willie pointed out the different agencies that are vaccinating right now. So those are our numbers. That doesn't represent the entire county. So when you look at entire county, 9,600 individuals over 65, 80% of them have been vaccinated. So that's a huge number, and that was really pleasing to hear. So yeah, we're running a full shot. We're running a full meal deal out there. It goes from 8 a.m. until just after 4:30. May have heard a few weeks ago there were lines that were somewhat long and people were having to wait a long time. That's gone. You get 3 type A females and they assess the situation, and we got that moving. So you are in and out in 25 minutes, unless you need to stay longer for an extended observation, but it's pretty darn quick. So that was really cool to be a part of. So one of the biggest things that's throwing us, Willie touched on the unpredictability of vaccine and when we're going to get it. So there is a 3-week allocation. We did receive 1,100. We will be receiving 1,100 doses of first dose on Monday and 1,170 of second dose. That's awesome. And then it looks like for the next 3 weeks, it will be probably cut in half. That's fine. We'll take what we can get. And I know that Willie's group is continuing to put in requests for vaccine as well. So between that, the pharmacies, I think we're pretty well covered. The biggest one for us though is the switch between brands. So we started off as a Pfizer shop because we have the capacity with the deep freeze. Works well for us. It's a 3-week, 21-day cycle. You schedule your first dose, you automatically get scheduled for a second dose at the same time 21 days later. And then they switch us to Moderna. So then it's all of those things have to start playing, and that's not where my brain works at all. I can run them through a line, but start projecting out, I can't do that. So we've got a good analytics team. So the shipment that we'll receive Monday will be for Moderna again. So this will be the second week in a row we've received Moderna. You know, is that what it's going to be going forward? Who knows? Again, we'll take it, we'll run with it, and vaccinate as many people as possible. And as we all woke up to this morning, that's growing again. So that's great news. Tier 1B, Tier 1 was this week, which included a large segment of our population. And then come the 31st, we have anyone over 60. What were some of the other ones? Over 60, anyone over 16 with 2 or more comorbidities or underlying health conditions, and then expanding it to that important part of our population that's doing some good work, the restaurants, construction, the mill, manufacturing, all of that kind of stuff. So I think we're really going to be able to pick up a big hunk of people. And yeah, that's kind of where it's at. It's a little head spinning, and it has, Willie said that we'd been doing it since the end of January. I mean, we've basically been doing it since the beginning of December because we were doing the 1A population. So it's been a long haul. And we do this in addition to running a full scale hospital and 7 clinics and an emergency department. And so anyway, anybody got questions?
So a couple of questions came in from Facebook, and I think between the two of you and Deborah that you can answer these. One of them is about J&J, and I know that one of the people, there's several questions about J&J. Basically, if I unpack this, it's when and where is the question.
Yeah, so that's no J&J for the next few weeks. So we do know that there are no allocations for Johnson & Johnson, and I understand some people are really that appeals to everybody, kind of one and done. But you know, you've all heard it said, if you're offered vaccine and you're eligible, you need to take what's given to you. They're all 3 very effective vaccines. They're going to keep you from getting severely ill, and they're going to keep you out of the hospital. And that's what we need to see. And, you know, Dr. Locke, I don't know, at some point this week in one of our meetings, made a really good statement. You know, we're done with COVID, but COVID's not done with us. And I think we can look at the cues that we're seeing across the nation and see that this could potentially get worse again. So that's, you know, vaccinating everyone is a real priority. So getting as many, you know, you didn't hear it from the marketing director, but is as loosely as you can interpret those guidelines, you know, make it work. Because it's super important, and you know, we've got the vaccine now, so yeah, it's. But.
And a couple of other questions, and the answer, Felicia, is yes. We're going to be posting all of that, or at least links to all of that, on the governor's site on our website. And so I would keep checking back, and please feel free to just email us and if you can't find something directly on our site or on the governor's site, and we'll source it out for you and send you a link. The other question that there are multiples of has to do not with availability, but with vaccine hesitancy. And it's been asked several different ways, but it seems like Amy's getting a lot more participation than vaccine right now. But are
Right
we
now, yeah.
anticipating that a crossover there sometime? And I would
do.
Yeah, okay.
I really do. And I expressed that to Dr. Mattern and Dr. Locke right before this call. We had that January sweet spot, kind of that middle of the month where we were opening up in age bands, and we were getting pummeled, and the website's crashing, just everybody trying to get it, and we're getting 1,100 doses at a time, and we've got 9,600 people who qualify. So it was incredibly difficult, and meanwhile, our neighbors, are being able to get it out a little bit more quickly than us and under different rules, and just kind of crazy. And so what we saw, and so I started the wait list, when is it my turn? And we had close to 8,000 people signed up. And when all was said and done, for whatever reason, of that 8,000, we only vaccinated a little over 4,000 of those. So it was a lot of different factors. Maybe they didn't get the email, right? I'm hearing that. The younger we went down in age, the more adept people were at managing the internet and finding other locations, and had the means to get there. So we're hearing a lot of people who went elsewhere. So the biggest group, our 9,600, are vaccinated, and then you go down from there. So then have they had the means to go somewhere else? I mean, that's what we're trying to see. So in the beginning, I put the appointments out on Friday and spend my weekend answering emails, getting everybody figured out. And by Monday, we were full. Like, that's it, sorry. And we didn't fill up until yesterday. Last night was when we filled up Sunday. So it's taken longer. And for whatever reason, is it hesitancy? Is it that they didn't know it was their turn? The rules change at a blank, and who's essential one week isn't necessarily essential the following week. So there is a lot of ambiguity. There's a lot of education that needs to happen. And yes, I do see a lot of hesitancy is my next hurdle, how to convince. And we're going to be, we do a series internally called Doc Talk, where our 3 medical officers kind of share their thoughts on basic questions that we have happening. Do we still, if 80% of our staff is still employed, or is still employed, is vaccinated, do we still need to wear our mask? And the answer is yes, because we're in healthcare. This is going to be the last place that we stop wearing a mask, but we still have these threats out there that we have to mitigate. So I'm hoping I can establish some time for those 3 doctors to meet, and we'll do another kind of doc talk and push that out and talk about the vaccine hesitancy, because they've got some really good little nuggets that they can take with them. And then with the question from Felicia there, I update our website every Wednesday and Friday, and it usually doesn't end up being until like 6, but I get it done. I get it done on those days, just not necessarily in the work day. But that gives you all of the information that we know. Like, we're being super transparent. Like, if we know it, we're telling you, and you can find it there on those 2 days. So that's a really good reference point for you too, just to know what's kind of happening and where we're at, and if we got vaccine and everything.
Amy, thanks. And there's a couple of questions in chat about youth. And so a question from Jay, and then another question from Jay. The status of our schools and vaccines, and then looking to see is 16 plus, is that Pfizer or Moderna?
Right. So 16 plus is that was one of the things that Dr. Locke and Dr. Matter and I just talked about a few minutes ago, because Moderna is 18 and Pfizer's 16. So I know we have a lot of young adults, kids working, down in shellfish farms and on the farms. So we got to figure out how we're going to work that, because we do have some Pfizer left. We've allocated it for a mobility clinic that we're going to be doing in, I can't remember the date, April 6th, maybe.
April 6th, I think, yeah.
Is it April 6th? Thank you. The dates all swirl in my head now. I can't keep anything straight. So people with mobility issues, that getting having a vaccine in a car might not be the best scenario for them, or if they rely on dial-a-ride or public transportation, they can have a clinic to go to. And so there's so many moving parts. It's crazy, people. Like, it's like having a party and not knowing what to serve or who's coming or what you're going to feed them with. So it's a constantly moving target.
Willie, there
And
is
school.
another question in chat from Kristen Manwaring at KMI. And she'd like some clarification regarding the clinic in Chimacum this weekend. And wondered if they chose other when scheduling. Is everyone eligible to schedule? Is it limited? Is this correct? What's the eligibility requirements for this weekend?
So that's a good question. The eligibility requirements are in line with the state requirements. So when we actually receive the vaccine, we have to sign a thing that says, hey, we're going to follow the state's eligibility requirements. So the best way to determine your individual eligibility is to go on what's called Phase Finder, which is let me look up specifically what the URL is. If you just Google Phase Finder Washington.
Yeah, Washington Phase Finder, and it comes right up.
Yep.
And there's a cool little chart there that you guys might use too, if you've got or know of people in multiple phases. It can help as well. But yeah, we're all incumbent to that, using Phase Finder.
Yeah.
And we have another question, which I think is something we should all share, and that's how successful has the phone service for people without internet been working? And is that a popular project right now?
Yeah, so that is still open Monday through Friday, 9 a.m. to 4 p.m. And it's been very successful. So whether an individual didn't have internet or didn't feel comfortable using the internet, had questions, they were able to call one of our volunteers and get some help signing up for their appointments. And then the hospital did a lot of outreach to their patients who they knew might need a little bit of extra help, and did some direct outreach to get them signed up there. But then we also had a list of folks who couldn't sign up for the email notification but wanted to know when an appointment was available. We were able to help craft that list and then worked through it relatively quickly. So we are and we were able to get through that on the 65 plus age band. If anyone does have ongoing issues, whether it's with Phase Finder, scheduling your appointment, we're scheduling for the Jefferson Healthcare clinic, scheduling for Tri-Area, and we were scheduling for the clinic in Chimacum this weekend, although that has fortunately filled up. So we're at capacity there. But even if you have, we're not advertising it for just kind of general questions. These are volunteers, not necessarily subject matter experts. But if someone, again, doesn't have the internet, they don't know where else to turn to get information, that's a great resource for them. Number 360-344-9791. And that's the EOC call center line. Again, folks can call that and we'll at least turn them in the right direction if they do indeed have a question.
Perfect. And we'll send that out with the updates that we got from DEM so that everybody has that. And we all run across people that have those challenges at our companies and that interact with us. And it's just good information to be able to relay. Deborah, you've been listening to all of this and you're saving your voice. So I want to make sure that we give you an opportunity to fill in the gaps that we have.
You know, I don't think there are any. I think Willie and Amy did an excellent job of speaking to the whole thing. I wanted to thank everybody that participated early on in the Jeffco Cares program. That was our local attempt to try to help you before we had government support, you know, coming in saying, yes, masks have to be done. You know, we wanted to give you the strength of unity. So you knew you weren't there alone as you were facing this issue and still welcoming customers into your place of business and your employees as well. And I think that was a reasonably successful program. I think it bridged the gap very nicely until the point where we had the governor and others finally coming behind us and saying, making mandates that hopefully made your jobs a little easier. And I just say, you know, please continue to reach out to Arlene. She has my number. She has me on speed dial. If there's anything that comes up that needs attention, we want to know about it so that we can craft a solution for you. So especially as things start heating up again, do let us know. Like Willie said, please don't hesitate to let us know if you're seeing recurring issues that maybe another Jeffco Cares type of an attempt could help you out. So that's all.
And I would share that we do have some resources here at the Chamber for some masks. So if there's a business that needs a small amount of masks in an emergency, we have some signage to help people remember that they need to mask up. And I would share that the TSA gave us information yesterday on a tourism call that was national to let us know that 8.7 million people traveled last week, which is the highest number since last February by about double. So whether, you know, COVID is trajectory has changed and whether hospitalization trajectory has changed and continues to, people have taken vaccinations and gotten on planes and celebrated the fact a little prematurely perhaps. And so the tourism traffic in Port Townsend has also increased and is going to continue to ramp probably despite everything that's going on, unless there are further restrictions that could happen anywhere. So something to be aware of and something to be certain that you reach out to us, to the Department of Emergency Management, to the hospital, to the governor's website to get updates and information and really stay on top of things. And we have links that the governor has on their site and we send out in case there are some challenges you run across. If you go into a place, and we've had several inquiries this week, which we then immediately speed dial to Deb so she can go to public health and arrange to have those sourced out. And that is businesses that have taken down their "you need to mask" signs a tiny bit prematurely or eliminated the need to social distance in very public places. So those are the kind of things that you know, we can help with, but there are also resources for reporting those things and mitigation. So we want you to know that. And I want to tell you that we are so lucky that, and I feel very lucky that I'm here and not in Yavapai County, Arizona, where I was before here. In Yavapai County, Arizona, 80% of the population has determined that they will not be vaccinated. And so right now, less than 20% of the population has been vaccinated. So let's talk about vaccine hesitancy somewhere. That's a challenge. And the same county has lost 10% of its population due to COVID. So we are very lucky to be living in this community with the services that we have, and our thanks to Deborah and to Willie and to Amy for this really informative and very timely update. And this community has been so focused for over a year on staying safe and staying healthy. And thanks to what you've done, has done a fabulous job of doing that. And we look to you for guidance so that can continue. And this community is totally committed to that, and to the revitalization of all of our businesses and the community, and a really amazing sustainable future that we have. So this Chamber Cafe has been fabulous, and I know that the video is going to be incredibly popular. So I want to sincerely thank all of you and know that we are here as a resource as well. Our chamber on April 16th, which is the first one that we're doing and the only one in April because the other one was scheduled for Good Friday, not a good day for a cafe. So we are on the 16th, we have Rob Berman from Centrum and his team coming on board. And it's a huge economic driver for our community. And the pandemic's been a real challenge. And so he'll tell us a little bit how they've pivoted and the amazing silver linings that have come out of this and their plans for the future, and not just sustainability, but major growth. So we're very excited about that. And I want to thank you all for joining us today. I wish you a great weekend, a fabulous 2021, and the wish that you stay safe and stay healthy. And then this one last important thing, shop local. Thank you all. Take care. Bye.
Thank you.
Thank you. Bye-bye.